Kidney cancer is the 8th most common cancer in Canada. Researchers at London Health Science Centre are testing a new approach that uses tiny radiation-filled beads to target tumors from the inside out. Dr. Derek Cool, an interventional radiologist at London Health Science Centre, explains how the beads work.
Anyone who's had family members or friends who've had radiation would probably be familiar with more of the typical external radiation, where there's a machine that kind of fires X-rays from the outside in and tries to target the tumor. This is kind of more of an inside-out approach. So what we do is we get a small catheter that we put into an artery in the groin, and we kind of navigate it up to the kidney, and specifically to the arteries that are supplying the tumor. And we can see that on X-ray kind of and make sure we're in the right spot. And then once we do that, then we deliver these tiny beads. So they're only fractions of a millimeter in size. They're actually made of little glass spheres. And in those glass spheres is a radioactive atom called yttrium-90 or Y90. And what happens is those spheres just kind of lodge right in the blood vessels in the tumor, and the radiation slowly decays from that Y90 and delivers its effect within a short distance, only between about 2 millimeters up to 10 millimeters maximum.
This trial is designed to offer new hope for patients who are not good candidates for surgery. The goal of the trial is to show that it works in the kidney.
This approach is what we call minimally invasive. So the incision we make in the skin is it's just tiny, about only a few millimeters to get our catheter in. The patient comes in the morning. The procedure takes usually about an hour and a half, maybe 2 hours. We don't put them to sleep, but we'll give them some medication to make them relax. Then about 2 hours later, they go home. We've found, in the patients that we've treated so far, the recovery has been really uneventful. In the sense that they haven't had issues with pain, nausea, vomiting, anything like that. So they've actually tolerated it really well.
If successful, he says the team hopes to expand the research into a larger study. Melissa Renoum, XFM News.